Let's talk about the under eye area and the lower eyelid. It's important to look at three important components within this area. So first we look at the lower eyelid, but there's also the tear trough area, the depression here, and the lid cheek junction. So the junction between the lower eyelid and the cheek, and then the cheek itself, its projection, and other features related to its relationship to the eyelid. So it's important to take each of these separately and then in combination. What happens in the lower eyelid is the most common concerns that patients present with are either lower eyelid bags or a lower eyelid darkness or a feeling of a hollow in that area. And so it's important to differentiate what's going on. If we look at the lower eyelid, the treatment for lower eyelid bags is to perform a lower blepharoplasty. There's two main ways to approach that. One is external and one is internal, and each of them has nuances to them. When you do an external blepharoplasty, there will be an incision right underneath the lash line, and that can sometimes be either just a skin pinch or something more involved where there's a skin muscle flap and we're taking away a little bit more skin than that. But really what I prefer to do is enter the eyelid from the inside. So through the inner lining of the eyelid. We don't touch the eye itself, we just go through the inner lining of the eyelid. And that allows us access to those fat compartments. In both external and internal approaches, the goal is to trim down, remove some portions of those fat compartments to give a better contour, and in certain situations, addressing the excess skin from the outside. My favorite technique is to go in, it's called the transconjunctival lower blepharoplasty. So we're going from inside the lower eyelid so that we can access through the inner lining, go to those compartments of fat and remove just enough without hollowing the eyelid too much, remove just enough of those fat compartments, and then let the eyelid go back into place without having placed any external incisions. So all the incisions are hidden, and the other advantage of that is that that doesn't cause any scarring on the external area that could be eventually pulling down on the eyelid or causing any downstream issues. Now, if there is a lot of excess skin, instead of going and placing an incision here, we have other ways of addressing that excess skin with either a chemical peel or a laser. And I feel like that combination is really the least aggressive on the eyelid and gives the most natural result. Now the tear trough. So that is the depression or this concavity that we're looking at here. And so there's different ways to address that. If we are doing a lower blepharoplasty, we can access from the inside of the lower eyelid, we can access the orbital rim here, and we can release that ligament to blend in the lid cheek junction. And that's an important thing to give the aesthetic result. There's also other techniques where the fat can be repositioned across that junction, and each technique has some nuances to it, and it really depends on the evaluation, the anatomy of the patient, and the chosen technique for what you're treating. Something that can be combined with a lower blepharoplasty or can be done alone if we're treating a tear trough is the use of fat grafting in very small amounts, but also breaking that fat to avoid any lumps, to avoid any fullness that's undesired, and filling the area of depression and blending in the lid cheek junction. That's another minimally invasive way to really address that area. Now, the third component that we're going to talk about is really the fullness of the cheekbone. And so different people have a different projection and fullness of the cheek. And depending on how projecting or not that cheek is, this will affect the relationship with the lower eyelid, and that's something we want to take into consideration in planning the appropriate procedure for the lower eyelid and when not to perform a lower eyelid surgery. But also, from an aesthetic perspective, this is something that we can augment either with fat grafting or other techniques to improve this fullness, but also this junction. And then one last thing that is also a common question that comes up is when people feel that it's not necessarily a hollow or a depression or concavity, but they feel that there's just darkness on dark circles underneath the eyelid. Different skin types have this to different degrees. And the other component is if there's been a lot of, if either the layer of fat is very thin or there's been loss of that layer over time, sometimes what we're seeing is not just the pigmentation, but the translucency of that skin here and the muscle that's underneath and the veins that are underneath sometimes are giving that effect of darkness. And this is where very careful use of a nano fat very, very conservatively can sometimes provide some help.